this project that has been recently published is about a new way on thinking about gene therapy for intractable epilepsy, and also can be applicable to other neurological diseases. And the rationale is that current classical gene therapy approaches for example, for focal epilepsies that are treating the symptoms, that are treating the seizures, are targeting all the neurons in that epileptic focus. And we know that not all the neurons are participating in the seizure, so in the pathology. So we thought that there would be a better way to also avoid other side effects, is to try to target really the neurons that needs to be treated and not all the neurons in that brain region. So as you say, we design a gene therapy tool delivered with an adeno-associated virus. And this tool is formed by an activity-dependent promoter. So a promoter that sends the increase of activity in the neurons that drive a transgene, an effector, that in this case is a potassium channel, that in turn decrease the excitability of these neurons. So it's a kind of a closed loop in which if a neurons feel too much activity, so for example during the seizures, this potassium channel is increased expression of this potassium channel that decrease the excitability only on those neurons that needs to be treated. So sparing all the other surrounding intermingled healthy neurons that should not be manipulated, basically. We tested both in animal models of epilepsy, as well as in human organoids derived from patient stem cells. So we did a lot of preliminary experiments trying to understand how this tool worked. So if it was following really the activity of the neurons, and we show that it can follow the activity of the neurons. We show that this tool is activated by increased activity, pathological activity. And we also show that it's transient. So if there is no any more pathological activity, it's switch off. So it's also temporal controlled. It's a closed loop also in time, not only in space. And we show that when it's activated, it can decrease the stability of those neurons. And then in the end, we show that in a chronic model of intractable epilepsy, we were able to decrease of 80% the number of spontaneous stage 5 tonic-clonic seizures in this model. And then we saw also that it was not affecting any behavior, cognitive and memory learning behavior in these mice. And then we tested also the same tools in human organoids, 3D organoids, and we show that we're able also there to decrease the activity that was induced by a chemoconvulsive to create like an epileptic form activity in these human organoids. And we show that when this tool was expressed in the neurons there was a net decrease of hyperactivity in these organoids. So what we wanted to test also in a human background was working, and we showed actually that was working quite well also there. I think that the next step will be to trying to bring it to the clinic, and we are investing time and effort and resources to trying to do the next steps that will be more on understand doing some tests of toxicology or possible side effects, and trying to build up data to be able to start a first clinical trial in the next 5 years, I would say.